All right, folks, welcome back to the show. Well, often on the show, we talk about Deja's pops, her grandfather, who I've had the opportunity to have lunch with a number of times and hear his dirty jokes. He's 90, what, he's 92?
92.
92 years old,
Still
and
at
boy, oh
it.
boy, does this guy got energy.
He is at it. But what we were really most nervous about in his old age is letting him live on his own. We just most recently brought him into an old age home just to keep him entertained because he likes to have people around all the time. But one of our first worries when he was living by himself was how is he going to take care of himself? And we actually had a nurse come and stay with him at his home. She was there almost every single day and really became part of our family.
Well, and it's a concern that a lot of folks, children that have older parents are facing these days. And we've got Amanda Wilkinson joining us in studio from mynursehealthcheck.com to talk a little bit about a program that really alleviates some of these problems. June is Seniors Awareness Month.
It is.
And tell us a little bit about this program that really connects nurses with seniors.
Well, My Nurse is a health prevention home care type program where we would send a registered nurse to your home. We discuss any concerns that you might have with your medical condition, monitor any active issues, and plan for the future.
So this really can be as simple as, ensuring the proper pills are being taken and that maybe proper nutrition and things like that are being put in place.
Right. So we would discuss any medications that you're on. We usually go through the list of medications that you're taking in order to watch for interactions, those types of things. Because sometimes, well, nowadays with the shortage of family physicians, you go to walk-in clinics and they don't always know what you're already on. So when they write you a script, you may have an interaction with another medication.
Well, and that's the thing, right? If you've got a nurse in your home, you kind of build that personal connection and they know your medications that you're on, they know your health history. Is that kind of the advantage? Is that why a lot of, kids are looking for this for their older parents?
I think that is an advantage. Bayshore tries to send you the same nurse all the time. So My Nurse really is your nurse. We get to know you, we get to know the family, we get to know your situation, and we try and help plan for the future.
Now, how long has this program been in place and how did it all come to be?
It's a relatively new program. We actually noticed that in Denmark, they actually have a government-funded program where after 75, you get a nurse to come to your home every month. And what they found is it actually decreases the amount of hospital visits, emergency room stays, things like going to the doctor. It helps with that. So it actually keeps seniors in their homes longer.
And on the other side of things, from the senior's perspective, is it more comforting to see the same face over and over again?
I think so. I mean, you become, like you were saying about being part of the family, they get to know who you are. So you call up and you say, hi, I'm Amanda, I'm calling from Bayshore. And they know exactly who that is. And they're very welcoming when you come to the home.
Oh, as you say that, I have to say hi to Shona. She's watching because she lives in Mississauga. And she really did become part of our family. And what I loved so much was that interaction that he had with somebody every day. Whether we could come and visit or not, we knew that somebody was going to be able to stop by. And was that part of the motivations for this program as well?
Well, that too. For families, it's not everybody lives close. I mean, if you live in Hamilton and you have a family member in Oshawa, how are you checking on them every day? So this gives you the opportunity to know what's happening with them. And mom and dad always say they're fine, even though they're not.
That's right.
And we're kind of the go-between. They kind of tell us what's happening, and then with their consent, we can tell you kind of what's going on.
And a lot of folks want to stay in their own home, which is a big concern as well. Whether or not you should take a senior to a home or not. Are you finding that a lot of people are saying that is one of the main concerns why they're going for this program?
I think so, because we do like safety home checks as well. So we'll check your house to make sure that there's no trip, fall kind of injury prevention stuff. We'll take a look at the bathroom. We'll make sure that there's grab bars or a chair that you might need, things to make it more accessible and safer for mom and dad to stay at home longer.
You brought up Denmark, which I'm happy that you did because they have one of the most amazing healthcare programs in the entire world. And you mentioned those home visits, and that's regulated by the government and is almost mandatory after a certain age. Do you think this is something that might be presented to the Ontario government perhaps one day?
I think maybe. It's a brand new program, so we've just launched it. We're trying to see what kind of benefits that we can have for Ontario for now, and then we'll actually launch it across Canada.
How much does it cost? Because I know that's a big concern for a lot of folks.
It is a huge concern. For a single person, it's $109 a month for a monthly visit.
Wow.
It's $129 for a quarterly visit. Now we can do mom and dad at the same time, so we can do both people. So a couple visit is $169 a month, and it's $199 for a quarterly visit.
Are a lot of seniors, looking towards this program because they're not able to get to their family doctor? Is transportation a problem?
Well, I think transportation is a problem, but so is mobility. The problem is not everybody's as mobile as we once were, and it helps to have somebody come to your home. The thing is, too, with a doctor's visit, you might get 15 minutes. A nurse comes at least for an hour. So if you have a concern, you can discuss a new diagnosis, a new medication, those types of things, and they'll take that time with you.
Can you discuss what happens when a patient or just a senior at home needs more intimate care? And I mean, in the examples like maybe getting help in and out of the bathtub, for example, and they still want, those mobility issues are really affecting them on their day-to-day.
Well, and I think that's a really great way to get into Bayshore Home Health is a home care company. So we do offer those types of services. So if we're out doing a My Nurse and we feel there are some concerns, we can give you the information on how to get a hold of another nurse, or we can initiate that for you and bring someone right to your home.
Now you offer complimentary nutrition advice as well, because nutrition is, you know, a huge part. You know, when you're a senior, you got to be on the right diet, and I know your pops like specific meals, and sometimes they're not necessarily good for him. Right?
Yeah, that's right.
It's true. We do actually look at what they're eating. I find mostly with seniors they don't eat enough. With mobility issues and problems in the kitchen, they don't always have the ability to make a full meal like they would when they were younger. So we can help with facilitating a company to come in and bring that for you, or somebody to come out and actually help you create those meals.
Now, I got to ask you about the social aspect of this as well, because you know, a lot of times, you know, seniors are in the home. If they're a widow or a widower, they're by themselves, and that social aspect. How does that really affect their overall health?
I think it causes a lot of other adverse effects. I mean, we can cause depression when they're not social and active. So with My Nurse, we can help you find different programs and different facilities that would allow you to go out and meet other seniors, get involved in the community, or we can even have somebody come out to your house. We have companions, so they can come out and have a cup of tea with mom or dad, or be just social and have a nice afternoon.
Well, you mentioned before, June, of course, is Seniors Awareness Month, but what is My Nurse doing to really promote this, get the word out there?
We're doing things like this. We're getting the word out there that these kind of programs are out there and that we really want people to get involved.
Now, you're a nurse yourself. Have you taken part in this program? Have you been to seniors?
I'm actually a My Nurse.
Okay. So tell us a little bit about, you know, some of the seniors that you meet and how has this program changed seniors' lives?
I think it has. I think more so for the families than anything. A lot of my clients' families feel like they can actually know what's happening in the home. A lot of times my families will call me up and say, can you make sure you discuss this with mom? I'm not really sure she's telling me the truth. And so then I'll go in, we'll have our discussion, we'll have our afternoon tea and talk about it. And then I'll come back and say to the daughter, you know what, we're good, she's fine, this is what's happening.
And really quick, just a few moments left, how has it affected you? How has it changed you?
I miss bedside nursing, so this is a really great way for me to actually spend some time with my clients. I get to know them really well, and it's kind of nice for me.
Yeah.
Yeah.
And lots of great stories too, huh?
That's got to be nice for them as well. It's a great program. MyNurseHealthCheck.com is the website. We've got Croatia coming up next.